Hi, I'm Kristen Alt, and we're going to be presenting Central Line Care today. I will be detailing the steps for it while June demonstrates for you. While going through the instructions, you will be provided one of these brochures while you're in the hospital to follow along. The first section we're going to discuss is dressing changes. Dressings need to be changed a minimum every 7 days. Unless they are soiled, loose, or wet, then you want to take and make sure that you change them at that time. Now we will go through the steps of providing a dressing change on your central line. Step 1, you want to put on a face mask and keep a mask on throughout the entire dressing change. Everyone within 3 feet of the patient should have on a mask. Wash hands with soap and water for at least 30 seconds or hand sanitizer. Once your hands are dry, take and put on clean gloves. We are now going to remove the dressing on the central line by pulling away from the hub towards the insertion site. If you have difficulty, you can use alcohol wipes. Once the dressing is removed, you want to remove your gloves and wash your hands with hand sanitizer that is at the sterile field near you. Sterile technique must be followed for the new dressing change. Never leave the sterile field unattended. Clean table prior to laying out your sterile field. You'll open your sterile dressing change kit. You want to pull from the tabs and lay the field out to get to the sterile gloves. Never touch on the inside of the field until you have your gloves on. Put on your sterile gloves. You want to set up your sterile supplies, open the bio patch, and have everything ready to begin the dressing change. Using the CHG swab, you will take and clean the insertion site and surrounding skin approximately the size of the dressing. Using back and forth motion, you want to clean for at least 30 seconds to create friction. Let area dry completely. Do not wave or blow over the insertion site to decrease drying time. Apply BioPatch over insertion site with blue side up. Once in place, you will apply the transparent dressing. Ensure that all edges are down and apply the small piece of tape, ensuring a complete seal on the line. You want to make sure to date the line so that you know when it has been changed. Remove gloves and face mask and discard all supplies. Dressing change has been completed. Now we're going to discuss intermittent cap changes. Caps need to be changed at least every 7 days. You may need to change more often while they're in use if blood is visibly seen within the cap after you have flushed the line. Now we will go through the steps of changing the infusion cap. Put face mask on everyone within 3 feet of the open central line. Wash hands with soap and water for at least 30 seconds or hand sanitizer. Allow to dry. Put on clean gloves. Once you have your gloves on, get your supplies ready for the central line cap change. Sodium chloride flush, heparin flush, CHG wipes, alcohol wipe, a new cap, and Kuros caps. Remove cap from one lumen of the central line, ensuring that the line is clamped. If the lumen is visibly soiled, you would clean with an alcohol wipe. Never use CHG. Replace with new infusion cap. You will want to flush with sodium chloride using a CHG wipe, using at least for 30 seconds and allowing to dry. Ensuring that you unclamp, flush, reclamp the line prior to removing the sodium chloride. Using a new CHG wipe, wipe the line again for 30 seconds and allow to dry before using heparin, following same instructions as the sodium chloride. If lumen will not be in use, apply Kuros cap. Central lines need to be flushed daily in between when they are not in use. These instructions are similar to what you were given during the intermittent cap change. We will go through the steps now. Set up supplies, including 1 sodium chloride and 1 heparin syringe for each lumen to be flushed, including CHG wipes and Curos caps. Wash your hands with soap and water for at least 30 seconds or hand sanitizer. Allow to dry. Put on clean gloves. Clean the cap of 1 lumen with a CHG wipe for at least 30 seconds and allow to dry. Do not blow or wave over the cap to decrease drying time. Do not allow the cap to touch any clothes or dressing while it is uncapped after being cleaned. You want to flush with the central line sodium chloride. Make sure to unclamp the line, flush, and reclamp the line. You'll repeat the steps, starting with using a new CHG wipe and flushing with the heparin syringe. Apply Curos cap if the line will not be in use.